only 11% of caregivers are receiving any training to assist their loved ones with all of these tasks, right? So we're asking, and people are managing so much without the support system to do that. And so there's this immense hardship on all of these facets, right? It touches like every facet of your life. And if you're not able to get out and you're supporting others, you're feeling isolated yourself, right? And the impact on our mental health. And so how do we offer this training, support
Yeah.
systems, respite, right? Join them in advocating for benefits from a policy standpoint. So I think that there's a lot that's happening.
Welcome to The Move In, a senior living marketing podcast from Unlock Health, a full-service marketing partner for the aging services industry. Join us for candid conversations exploring the latest marketing strategies with the senior living community leaders and innovative solution partners who are moving our industry forward. Together, we'll build a community to build better communities. What if one of the most powerful ways to grow trust in occupancy in senior living isn't about promoting your amenities, but about deeply understanding and supporting the families making one of the most challenging decisions of their lives? Hello, I'm Larry Williams, and welcome to the Move In Senior Living Marketing powered by Unlock Health. That's the conversation we're diving into today as I'm joined by Nicole Will, founder of WillGather and a passionate advocate for family caregivers. Nicole brings a rare combination of personal caregiving experience and professional insight into how we as an industry can better serve not just older adults, but the families navigating these emotional and often overwhelming transitions. Here are a few things we discussed in this conversation. Family first. Marketing must prioritize caregivers, offering empathy, education, and support well before they're ready to move. Bridging the gap. There's a huge opportunity to connect senior living with a broader care economy. Think influencers, tech platforms, and policy advocates. In leading with humanity. At the end of the day, this is about building trust through real connection, not just campaigns. If you're in senior living marketing, operations, or care, and you want to better include families and caregivers into your strategy, this episode's for you. Let's get into it. All right, we are on the Move In Senior Living Marketing. I have Nicole Will here with us. Nicole, looking at your LinkedIn profile, we were chatting about this earlier. You have a lot of roles. I'm so glad that James Lee connected us, but I was just blown away of how busy you are. So real quick, I'll go over what all you're working on these days. You're the founder of WillGather. You're the Innovation Medical and Science Advisor at Lorenzo's house, and you're the executive advisor at HomeSite. So you're staying busy these days. So welcome to the podcast, Nicole.
Thank you. It's a joy to be here. I was looking forward to this conversation. We actually got to meet in person a little bit ago, which was awesome. And yeah, staying busy, doing my best to, oh my gosh, connect people, bring some awareness and insights. And yeah, it's so fun.
Yeah, no, it's obvious that you love to connect people and love to have those conversations. I'm so glad that James connected us. And
Mhm.
so, yeah, we saw each other at Argenum. And I think I kept you from getting to your session on time. So I apologize for that. But it was so good just chatting and catching up and really understanding your passion and what you're working on. And at that point, I was like, Nicole, please join me on a podcast soon so you can really discuss what really sets your heart on fire, because it's obvious that you're a proponent of the aging services space and really doing right by others and creating an environment for everyone to thrive. And I appreciate your approach and how you want to have these conversations. And so as we led into this conversation, I kind of stayed on you. I was like, please, Nicole, will you please join me for a podcast episode? And I said, like, what do you want to discuss? And so when it came down to it, you really want to discuss really how families want to be understood and how important that is to you. I think that's a big part of this narrative that we're really trying to shape it from what it used to be when you thought about aging services to now. So just starting off this conversation, why is that so impactful to you? Like, is there something in your journey that kind of shaped that mindset?
Yeah. Oh my goodness. Absolutely. And you didn't make me late. You know me, I'm a head early kind of girl, so I was all good and enjoying our conversation. But yeah, for me, it is really this intersection of personal and professional caregiving. So my work really began at the intersection of having my grandma live with us. So I was 15 and she moved into our family home, and I had this ability to have her develop this like amazing relationship. And she was like one of my best friends, and she had the uh, biggest personality. We got to hang out and do a bunch of really fun things. And when I was young person, having her have this insight into my life, it really shaped my direction of going to study gerontology. And so through that course study, I had the opportunity to become a director in senior living and work with a ton of families. My first position was on a transitional care unit. And so we had 100 residents that would come in and out. And as you can imagine, that's like multiply that by how many family members,
Oh,
right?
sure. Yeah.
Like so many family members. And much of my life, right, being a caregiver from also the professional side through the personal side, I've seen these two systems come together of like the heart and then the system and the healthcare. And so I began to see and realize how many families are overwhelmed, unseen, and unsure of what their steps are and when they navigate care, what decisions they're making, how to take care of someone that they love. And it led me to launch WillGather, which is a platform and then a podcast that focuses on how do we support family caregivers? How do we elevate voices in the care economy? And how do we connect people to really make a difference? So, through the crossroads of, I would say, advocacy, education, connection, helping organizations understand the people that they're serving, creating empathy, and having these like honest conversations and heartfelt stories of care.
I love that. Thank you for sharing that. And like you said, it's a time in people's lives where they need some guidance, and it's a new phase. And there's so many like emotional
Mhm.
decisions that are taking place, and people often feel lost. So thank you for that. Question for you: the podcast. What's the name of the podcast?
Yeah, the podcast is Navigating the World with Your Aging Loved One. And it's a longer name for sure. But I really wanted to express how we're addressing those concerns, right? We are walking this road with people that we love. And so within that, we want to feel empowered to make really great decisions, not only for ourselves, but for the people that we're caring for.
Yeah.
And it just encompasses all that goes into that, right? Like when you think about aging, you've got the caregiving side, you've got healthcare, you've got understanding the disease process that your loved one is going through, you've got legal considerations, financial, mental health, wellness, like all of this really is that. How do we offer these different pillars of support that make up this whole picture of how do we navigate aging? Yeah,
Oh, sure. And it all interacts with one another. It's not this linear process. It all works, you have to understand the entire journey.
right.
And it all, intersects with one another. So you mentioned about Will Gather. Will you tell me a little bit more about Lorenzo's house? Because it sounds like some great things are happening there as well. And you're having an impact you continue to have impact on families.
Right. Lorenzo's House is an incredible organization. Diana is the founder, and she was walking this road with her wonderful husband, Lorenzo. And he was diagnosed when he was younger, and her sons were 9 and 13 when he received his diagnosis. And as you can
Wow.
imagine, that is just incredibly heartbreaking, but also she was looking for hope and information and really couldn't find anything that supported the children and the families that were walking
Sure.
this road. So she decided to create it. And Lorenzo's House is a global nonprofit organization that supports the children's and the family through various youth summits, through support groups, through education, through dementia justice, which I love that perspective of, can we give these youth something that they can fight for and make change? And so that's a really big component of that. How are we creating awareness? How are we getting rid of the stigma that this is something that can only happen to someone that is older, right? This can
Sure.
affect many people. And how do we show up for them in ways? So I support them in a lot of different capacities as a dementia cater for their youth summit, also using my platform and my voice, and really looking at how can we create awareness and bring people together and come up with ideas and system changes so that we can move this mission forward. And because they are also a virtual platform, we are able to reach people from around the globe, which is really
Yeah.
incredible. Yeah.
That in one phrase that you said, I think is so impactful is creating those support groups so
Mhm.
others can feel like that there's others in this community that understands what they're going through and can
Yeah.
help them along in this journey instead of feeling isolated. So thank you for the hard work that you're placing there and for everyone else as well. And I just also I'm curious about Homesite. I gotta jump into that and find
Oh,
out more about that if you don't mind.
oh
Because
my
I think
gosh.
all of this shapes really this conversation we're having today about, how do we connect with people where they are in this journey? So, yeah, if you don't
Absolutely.
mind, give me just a little feedback about what you're working on at home site.
Yeah, absolutely. And first to talk about like the support, right? When you see these kids come together and find each other,
Yeah,
oh my goodness, like they finally feel like I am not alone. And there's another high school student. They may be in California, but they've got
yeah,
ideas and we can talk and share with each other. So, yeah,
yeah.
super cool.
And it shows the power of community. And
Mhm.
that's in different levels. And even, these kids or teenagers having that, it's so impactful.
Yeah. Oh my gosh, so much so. Yes, home site. When we look at all of the different people that are involved in aging services, we've got human connection. We also are hearing a lot about age tech and technology, and we've got organizations, right, that serve all of these different groups. And home site plays a really cool role in providing the support through the technology that we need to have systems of right connection. Are we able to share and connect, whether it's message, video, conversation, integrating smart home technology, which is so important as a lot of our homes are able to do that. We're using applications and all of those different platforms. Looking at the whole person. So, having wellness, biometrics, being able to be pulled into that, and then building out an engagement platform so you can find whether it's entertainment, support with transportation. How do we interact with our loved ones in meaningful ways, right? Are we going to be able to do a travel program? So, like looking at that holistic approach from that capacity. And then it brings everyone together in a care partnership on a dashboard. We are looking at how do we partner, whether it's with home care organizations, home site for families, which is an app that everyone can have on their phone, and then the extension of that moving into organizations like senior living that can really integrate all of these great partners, but bring them all together under one location, which I know for families is a huge benefit to. Right, when you're having all of these different maybe devices or systems that you're using to have the emotional burden of thinking about how do I manage all of these different things and how can I do it all together? So being able to alleviate that, bring it all together, have them be a part of the care team and honored and being a part of that one system. So that's the general overview about Homesite. And for anyone interested, I'm happy to share more at another
I
time.
appreciate
But
that.
yeah.
No, and one thing that you mentioned, and I think it's really important, is we have so many different, I'd say, technology platforms. We have so many use cases. We have all this information. It's about pulling it all together. And I
Yeah.
feel like sometimes we're overwhelmed with information and data and what
Right.
can be, and just be able to pull that together so we can create a better system, a better
Yeah.
place, and a better experience. And
Yeah.
so I appreciate you saying that. And it kind of leads me into the conversation, which is thinking about on the marketing side.
Mhm.
We have so many different data platforms, we have so much information, we have so many ways to connect with people. But
Mhm.
I know in your heart, we need, what you're saying is that we need to really connect with people at a different level, especially the caregivers. And I feel
Yeah.
like often we get caught up marketing instead of bringing people together and being a resource. And just that being said, like, where do you see us both going right with our marketing activations? And where do you see it room for improvement in terms of really connecting with families and the care, the ones who are acting as caregivers currently?
Mhm. I know. That's such a great question. It's, I think to understand, like, what we get right and where we're going, I wanna share a little bit, if that's okay, about some of the
Yeah.
data that just came out. So
Loves Everybody loves data. So
yes,
please, the floor
love
is yours.
I know. So AARP and the National Alliance for Caregiving released a new report that looks at the snapshot of what is caregiving in the US in 2025. So the data revealed that there are 63 million Americans that are family caregivers, so providing care for an adult or even a child with a
Sure.
medical condition, and that's nearly 1 in 4 adults. So in
Wow.
the past year, there was an increase of 20 million from 2015 to 2025. So of these 63 million caregivers that they were referencing, 59 million are caring for someone over 18. And there's a whole report available. You can find it on AARP, but there is an ability to, if we understand the landscape, I think we can look at where we can help support some of those gaps. So, just some more data points that for a lot of caregivers, being 40 hours plus of care per week. And
Wow.
a third of those have been caregiving for 5 years or more. So specifically, right, when you have a loved one living with dementia, we know that that can be a very unknown, longer journey for a lot
Yeah.
of people. So there are a third of caregivers that they're also raising children while they're caring for a loved one. And the financial strain is huge. They are taking on debt. They are unable to save, right? They're unable to have
Mhm.
access to affordable services. And 6 in 10 family caregivers are also employed on top of
Oh,
providing the
sure.
caregiving.
That's
So,
another 40 plus hours.
my gosh, yes, and it impacts
Yeah.
their work and their leave and their ability to potentially, um, be up for promotion, right? If they're having to make sacrifices, right, in different
Yeah.
ways. They're reporting that their health is suffering, so 1 in 5, they report that their health is fair or poor. They're struggling caring for their own health because of
Mhm.
their caregiving
Sure.
responsibility.
Well, they're putting themselves last typically, I'm sure.
Absolutely,
Yeah, they're
absolutely.
taking care of everybody else, and this group, they're not able to take mental breaks. They're not
Yeah,
able to get away, and probably typically not able to really go on a vacation, but they're in it all the time. And as
right?
you were speaking, I was thinking about the financial strain, the
Mhm.
time commitment, and the emotional burden that this group takes on. And so
Yeah,
it's so much.
yeah, completely. Yeah, and when we look at, only 11% of caregivers are receiving any training to assist their loved ones with all of these tasks, right? So we're asking, and people are managing so much without the support system to do that. And so there's this immense hardship on all of these facets, right? It touches like every facet of your life. And if you're not able to get out and you're supporting others, you're feeling isolated yourself, right? And the impact on our mental health. And so how do we offer this training, support
Yeah.
systems, respite, right? Join them in advocating for benefits from a policy standpoint. So I think that there's a lot that's happening.
Oh,
A lot
yeah,
that's
for
happening.
sure.
That's just some of the data, right? Um,
Yeah.
when we look at, historically too, where families go to for support, they typically will go to like a family or a close friend, right? For emotional or practical support. I think it's like 76% will go to that. They do go to their healthcare professional when they're looking for diagnosis or guidance, but only like 20 some ish percent report that their provider can actually help them navigate the
Yeah.
options, right? Because
Yeah.
that's not billable. And so the lack of support in that regard, right?
Yeah.
A lot will go online. A lot will look for support systems on social media, which is something I do want to reference at some point. Just the amount of care influencers that
Mhm.
are present, providing really, really great resource. There are support groups. Only 26% are really participating in support groups. We look at faith-based organizations, different area agencies on aging. We've got technology, right? Well, that'll be growing. But when we look at the data with where families are going to support, and even in conversations I've had, they aren't going to senior living. And I think we have a really unique opportunity to be a support system and a partner in supporting people at home.
Yeah, no, I agree,
While they
and to
live
be a
in our
resource.
communities. Yeah.
Yeah, and it's a huge opportunity, and then, as I was thinking about this conversation and even, in my role with a marketing agency, we get caught up with the different marketing activations. We get caught up with the data. We get caught up with SEO and paid media. And
Mhm.
sometimes you got to take a step back and really understand what does that journey look like and who's in that journey and how can you connect with people and really what are those opportunities. And,
Mhm.
as you were discussing the different, places that people typically go, the physician, yeah, they can listen but if they're not really in that same spot, it's a different level of empathy. I can only imagine. They could prescribe medicine if they're struggling with some anxiety or some other health issues. The online market, it's huge, and you can really go in different directions on that front. I can see also that social media continues to grow, and like you said, those care influencers, and you're getting a lot of direction, a lot of support on that front, especially if you're able to connect in someone's algorithm. It changes everything. So you feel like there's someone who understands what you're going through. But again, I think about what you just said, which is
Yeah.
the senior living, on the senior living side, you can connect and offer a different level of support group and
Yep.
and and who can help and guide and support this journey, but also bring community in. And so
Yeah.
you're actually connecting together.
Yeah. Absolutely. Yeah. And I pull out, I don't, you can see this. So the CSA journal, which is the Certified Senior Advisor, it's a national trade journal. And James and I just wrote an article. This is hot off the press because I don't even know if it's like really, really out yet. But we wrote an article on the rise of caregiving content, how
Mm.
social media influences are shaping conversations in the care economy.
Oh, that's
So,
incredible.
oh my gosh, so incredible because when we
Yeah.
look at the amount, we just looked at that data. We know that families are really in it, right? And they're navigating it and they're going to your most familiar platforms, right? So let's say Instagram or Facebook or TikTok, we're already on it. We can
Sure.
absorb information that it doesn't cost anything. We can
Yeah.
digest it in little bits, which is also why I love podcasts. You're able to put a headphone on, still maybe fold laundry, go for a walk, do the dishes, right? All the things and absorb it at your pace. And I think where I would love to see senior living also shifting is how can you partner with all of these people that are walking that road of caregiving themselves,
Mhm.
having conversation, having insight. Maybe our marketing looks like, can we shift and can we hire family caregivers to help us tell our story,
Yeah.
to share what they're navigating, to be able to amplify the voices. How are we really understanding? It's kind of that whole idea of with, not for. And I felt
Mhm.
called to do that in my work of, rather than me saying, here's everything you should do and why you should do it, it's really leaning in and being curious and partnering with people that are living with dementia, that are family caregivers themselves, that are trying to navigate systems and make change, and really amplifying them to be able to be the ambassadors and to share the message and to give them whether it's the income, the support, and the visibility to help us make change collectively. I
Yeah.
think that's where we need to shift from. And I think you and I talked about it a little bit maybe at Argentum. Is I see I see kind of two worlds. So we've got senior living on one side, we have the care economy, caregiver support organizations, um, tech companies kind of on the other side. And unfortunately, I think we're getting a little bit better, but they live a little bit separately. And
Yeah.
so there's an entire care economy that's happening globally, organizations that are making change, leaning into amplifying the story of what it's like to care, right? The movie just came out where Bradley Cooper was the executive producer, called Caregiving. We had another film come
Yeah.
out called Familiar Touch that was actually filmed at a front porch community in California, that is stepping into more of this mainstream conversation of, are we are we listening and providing support and visibility and really understanding what caregivers need to, right? We looked at the data to actually get through, not only just survive this time of life, but
Mhm.
really thrive and feel supported.
Yeah.
And so I would love for senior living to create, whether it's a position, right? If you've got a national organization, can you create a position that their role is to really learn and know family caregivers, to support them, to provide resource, to build out education, to be able to curate what resources would really be helpful. Here's care influencers to follow or to partner
Mhm.
with. Here's at a local level systems of support so that they can step in. Maybe it's 5 or 10 years prior to that move in, be the place of the support system, build the trust. I think, a lot of times families will say, they don't really maybe step into a community till you've got that event or crisis. But when we have to make that decision, if we already have built that relationship over time, we already have that trust over time, where are we going to go? Right? We're
Yeah.
going to go to
For
someone
sure.
that is familiar and that we know has our best interest without the
Yeah.
pressure, and lean into what the support system is even like for a family that lives in the community, or their loved one lives in the community, but the family member is their family caregiver and support system.
Yeah.
So I think there's a lot of opportunity. As of right now, I know that there is one community specifically, um, Couch Communities. Dr. Benjamin Searmy has more of a forward-facing family caregiver education role. I think that that does live under different departments. I know marketing, right, does events and trainings and opportunities for families to come in or hold support groups. So I know that I'm speaking more broadly. I know that there are communities doing really good work, but there is not, to my knowledge, these rules that are really created to say our focus is to alleviate, to support, to provide resource, and be that system of change that can actually support families through that entire process until the
Yeah.
move, and then
No,
even
I
after the move in.
well, and that's what it works if it's meant to be, it leads to that point. But my theory is that you never know what type of information and what that good will get you. And so just by doing the right thing, it leads to the right results, right? And
Absolutely.
so it's about spreading that goodwill. And even though that, this person might not be a move-in, they're going to have a community of others, and they will promote you just by your community providing the right information. And one thing that you mentioned, I appreciate is really highlighting the importance of curating this information. And it might not be a care influencer that works for your community, but it's
Mhm.
someone else. It's about bringing together the right assets. One thing that I think that could be really impactful is just really pulling in that community. And when I say this, I'm not talking about the community that someone would move into, but actually within a certain, I say, geography, so a certain location, you can be a place where people can gather and feel like they're amongst others who understand what they're going through. And I think that's something that senior living communities can really, when I say leverage, I don't mean that in a negative, like a marketing plan, but
Absolutely.
it's an opportunity to bring people together with
Yeah.
empathy and understanding. I think far too often we're in marketing, especially we like using that megaphone and saying all the great things and telling about the stories and really connecting people where they are on that journey. But there's something about creating this place where people come together and have that shared experience. I know, a lot of times there are open houses and this event, but I'm thinking about on the care, that caregiving journey side, how impactful that is. And I'd love for you to, really go in a little further. If you had any advice for
Mhm.
senior living marketers who
Mhm.
are looking to really open up these doors and these conversations. I know we want to do it through content. We want to go about it with like you said, pulling together the right information. But what other advice would you provide of those who are trying to really take those next steps?
Yeah. Yeah. That's a great question. And you had referenced, right, that maybe they might not make that move, but just by doing right good.
Yeah.
And when we look at, the data of 76% of family caregivers are supported by their friends or their loved ones, or that's where
Yeah.
they get, advice. And so if you look at it from that perspective too, you may be helping the community at large, but we always share about the things that we love. Like I
Yeah.
got a dress that I loved the other day, and of course I had to like tell 5 of my friends. So same idea, right?
Yeah.
So this organization has been so
Mhm.
amazing and supportive, and I've learned so much, and I felt so seen. You're gonna tell people about that.
For
And so
sure. And
the
if you see someone hurting and we're at the
yeah.
face of life of, especially in that sandwich generation, you're taking care of your parents as well as kids.
Mhm.
When you speak to others and they start getting into a little bit more of some of the stuff they're going through, you will mention this, like, "This has really helped me out. I'd highly recommend you make these connections as well, and this is a
Yeah.
great group." And like you said, it just spreads like a wildfire in connecting with others within, that region.
Right, right. Yeah, there was, I will address your question absolutely. This
Oh,
ties
sorry. We see, this is a
No,
problem. This is
I
why I
love
may
it.
be late
I
to
love
this session, Nicole, is because we start speaking and then
this
we
is
start speaking
so
about a
cool.
different topic. I forgot I even asked the question. So,
No, I
yeah,
love
please.
it. It's so great, but I'm like, "Oh, I've got all these things I wanna say."
It's
Um,
so there's so much to unpack here, though.
there's so
There's so
much.
many different ways you can go in this
Yeah,
conversation, and this is why I'm so glad you joined me today, is because this is
yeah.
something that's really important, but we often overlook this
Mhm.
aspect when it
Right,
comes to aging services.
right, right, which blows my mind because when you think about it, our entire industry of senior living is built from families making a
Yeah.
decision because they're at a crossroads and
Yeah.
their loved one needs to make a move, and where do we do that, right?
Yeah.
So that's the entire foundation of everything that we do in senior living, in my perspective,
No,
right?
I agree. And real quick, I'll say this is that I feel like we do want to speak to the senior living seeker,
Mhm,
if it's, independent living or even to, assisted living. And
mhm.
then, the family members and how
Absolutely.
important we say that this is so important. But I
Yeah.
think it's really, really necessary that we start thinking about the depth of that instead of just kind of pointing a certain
Right.
direction. Let's have a lot more a stronger foundation in what we're saying and really the guidance we're providing and how we pull people together.
Right, right. Yes, yes. I was at the U of M. Dr. Joseph Gogler has a family caregiver conference every year, and I was a part of it participating. And I had a woman come up to me and she was sharing her extensive caregiving story. So I'm just going to preface it like that,
Yeah,
of the amount of overwhelm and how she's trying to figure things out and the amount of, time and energy spent. And I said to her, "How long has your mom been living with you?" Because of how she was explaining this
sure.
caregiving was going. And she said, "Oh, she doesn't live with me. She lives in a senior living community."
Hmm.
And there is also, right, so we're talking about a couple of things here, not only the families before they're making that decision, but the families and the older adult, even when they're living within our community, still are identifying as a family caregiver.
Yeah,
So within that, with our role of not only, right, reaching and supporting the broader family caregiving community, but it's also how are we best serving the people that are living within our community?
for
Because
sure. And
they are
thank you for highlighting that.
yeah, yeah, they're also our voice and our recommendations to the people that they talk to and share and serve. And so that is, I would say, one of the most profound, not only like having that interaction, but also what I hear from families all the time is being in that family caregiving role, right? A lot of times we're still providing financial oversight, we're powers of attorney, we're managing healthcare decisions, we're managing whether it's right, a rental agreement or a healthcare contract. We are, if our loved one has an apartment, maybe some of those groceries aren't included in a service. So we're still going to the store, we're picking up
Yeah,
their medications, we're being the emotional support system, we're
sure.
visiting, right? Like when you think of, we're making sure our loved one's mental health is okay. Are they happy? Do they feel
Yeah,
purpose? Right. So it lives far beyond just the prior to being a resident. It extends far beyond after that. So, how do we do that well? How do we have those support systems? I
mhm,
think having someone that can be dedicated, whether it's a role that's already lives within your community, making just a really concerted effort to making family caregivers and supporting older adults and families a huge part of that, creating a role that would be of benefit, right, to that place of care that we're in. I think
sure.
it is really being able to understand, can we have senior living educating themselves on
Mhm.
family caregiver data and the landscape of family caregiving? I spoke about this with a panel at Florida Senior Living Association a few years ago, and also TALA, Texas Assisted
Yeah,
Living Association, of how can we really effectively serve people if we don't understand and know why it's important to serve them and
sure.
and what they're navigating. Um, Educating families, providing support groups. I know communities do that. Being really, really intentional. We talked about how families are really lacking training. Can we
Mhm.
provide training on transferring and uh,
Yeah,
helping with meals and all of the different components that go into caring for someone at home, right? Can we have like a certification for them in a way that can
mhm.
give them that confidence to do that well? And I would say, a lot of times, and James Lee and I have talked about this, is that shifting our language from, a lot of times when people move in, it's like, um, we've got this. You can be a daughter again. You can do the things that you need to do, and we'll take care of everything.
Mhm.
And I think it's well intended, but I think what we miss is acknowledging that you're a care partner and your role is still continuing, and we don't want to dismiss and make light of the contribution that they've
Yeah,
made and that they will still continue to carry, right?
yeah.
just to feel seen in that, be intentional about the questions we're asking the people that are living in our communities. Um, I had a podcast that I did with some residents that lived in a senior living community. And I felt really strongly about having the voice of the care recipients. What is it like to receive care? And what do you value? And what's made a difference for you? And that podcast was so incredible to hear their honesty, their vulnerability. But I think for us to understand, putting ourselves in that position of, one gentleman was an attorney his whole life, right? Very accomplished, and slowly has lost, right, all of those things in the independence and what's made a
Mhm.
difference for him. And so, while I know that not every family is going to want to be hands-on, right? We know that those dynamics exist,
Sure.
but I believe creating space for the opportunity to really acknowledge, um, provide the information and the support systems. And again, I think, like I was sharing, there's an entire care economy that's happening. If we in
Mhm.
senior living don't have awareness of that and what's going on, how can we make recommendations for families? How can we say, this app would be really great if what because of what you're facing right now, or what, follow this person. She's got really great tips as your
Yeah.
mom is having a hard time communicating, or whatever the case is.
Sure.
um, really understanding what's happening so that we can step into that place when we need to.
Yeah, no, that's really great insight, great feedback, and I think about what you said about the care partnership. And like you said, it's as the community level. We all have the right intention, which is, hey, we got this. We'll take this on, but it's not a transactional business agreement. It's your loved one. It's the person who typically raised you or there for you, and how important that is to work together. But at the same time, from the senior living community perspective, continue to provide resources, provide people, provide mentorship, provide a place of support and belonging.
Mhm.
And far too often, and we kind of started the conversation with this, which is we have so many tech platforms, we have so much information, but
Mhm.
sometimes what we need is human gathering, and just being a human at different points, and sharing community. So this
Right.
is such an important topic, and I'll keep saying it, which is this is something we don't discuss enough, and this is a conversation I don't discuss enough on the marketing side. And I'm glad you brought this up, because I do think this is valid information as we continue to think about AI and all the different tech platforms. This is a different level. This is more human to human, and we need to really interact that way. And the phrase I wrote down, while hearing you kind of go into some of this, is peeling back the onion, because the more you peel it back, the more you understand there's so much complexity to it,
Yeah.
and there's a foundational level of struggle when it comes to the emotional, the emotions and the financial and the
Mhm.
time, and even those who are providing that caregiving, like they're helping here, well, they're
Mhm.
taking away somewhere else, and it might be other relationships, and there's just so much to unpack. So
Yeah.
thank you so much for
Yeah.
bringing this up. Thank you for discussing this with me today. We're all better because of it. Now, one thing I got it before I let you go,
Mhm.
talking about just having the right conversations.
Yeah.
I want to make sure I bring up the think tank.
Mm.
It's the I say it's a conference, but it's not really a conference. I don't know how to really mention it,
Yeah.
and you'll do a lot better. You'll do it justice explaining it. But I'm excited. I'll join in December.
Mhm.
Spoke to James last year, and he said you got to join us. For me, last year was the day after I ran my first marathon, which I knew my legs, I was going to be exhausted. I would not be worth much if I went to it last year. I'm excited to join everybody this year. And you're an ambassador for the think tank. You
Yeah.
helped James. You
Mhm.
you got me real excited about speaking about it while we spoke at Argentum. Tell the group about what think tank is, and why it's important to this community.
Right, right. I know. It's like, is it a conference? Is it a
Yeah.
retreat? I mean, it's kind of a combination, but yeah, it's an
And
intentional.
real quick, Nicole, I gotta tell you, so the way I explained to my team and
Mhm.
to the my manager, I was like, it's hard to explain. not going to say there's going to be leads, but I know I need to be there. Yeah. I still
Absolutely.
just need to be
Oh,
there. So,
so good. I'm so
please
glad.
tell everybody I cut you off. I
Yeah.
apologize for that.
No, that's okay. We're so looking forward to having you. So cannot
I'm
wait.
excited.
Yeah, it is. It's an intentional small gathering that brings people with heart and passion and insight and leadership all together to be able to put something out into the world for the
Yeah.
greater good. So, parts of those components are personal development, leadership, right? We've got facilitators that guide us through being able to empower us as leaders and people and humans, right, in this space as we're growing and changing and evolving.
Yeah.
We've got the small group component, which is we take hot topics and aging services and really dive in and come up with a deliverable for change for good, right? So whether it's a white paper, a podcast, a video, right? However, people decide to best share the information that we're learning. And then the other part of that is relationships. So because the size is not so large, you really get a chance to meet everybody and spend time
Mhm.
and conversation and networking. And while we always say, okay, this isn't right, you're not going to have an exhibit hall or a booth to like share about your company. We really feel, and what I've seen play out is though the byproduct of doing work together, meeting people, sharing the same shared passion. So many partnerships come from think tanks. So
Sure.
it's kind
Yeah.
of like this beautiful reflection of that, which is so cool. And as we were talking about peeling back the onion, so when we really peel back the onion, part of why James started Think Tank was all of these events that we go to, the money spent on various things. Do we really bring that back and then share? Is there change happening? Do we tell our families, right, and our older adults what we're learning? Because when you really get to the facts of how these types of events and any senior living, right, event is funded,
Hmm.
it's from the family and the resident, right?
Yeah.
So, do we have a ability to have really good stewardship in what we do with those funds? I believe so, right? When we
Yeah.
look at the immense burden of that. And so, can we then take something where we're honoring, we're being a good steward, we're
Sure.
also creating a ripple effect of taking time and resources to really work on some things that are hot topics that need to be addressed so we can create change that will ultimately impact the lives of those residents and families and the people that serve them for good.
Yeah.
And so when we have that framework for think tank, bringing everyone together, it's been quite remarkable to see like all the different deliverables come out,
Yeah.
the different conversations, the change being made. And yeah, so we would love for people to join us in December
Absolutely.
in Austin.
We will put the link to the show, in the show notes to
Mhm.
the think tank. And if you don't mind, once we wrap this up, you passed along quite a few resources. I might see if you can send those links to me, including the
Absolutely.
article, so we can
Yeah.
include those as well, because this is all really important information. And when you were telling me about the think tank, that
Mhm.
the phrase I wrote out was "pay it forward," and
Yeah.
that's what you're talking about, being a good steward. When
Mhm.
people like do business with us, we want to take what we're learning and growing and continue to push it forward and say, what are better ways? We have this information, how do we improve upon it? And I think that's what's going to be important as we move into the future. So, Nicole, thank you again. Thank you for just having this conversation and bringing this up, because like I said earlier, we get so caught up in marketing messages and how to go about this, and I feel like it gets where we kind of just keep pushing this ball forward. But we need to stop and think about what we're really doing and what's the purpose and what's the goals there. And I think you did a great job of bringing a different perspective, so I just want to thank you for that. Where can people find you? And again, I'm going to take all these links and add them, but where can people find you to learn more about what all you're doing and to have a conversation with you?
Yes. Well, thank you. And first, I so appreciate the opportunity to share and give a different perspective. And I know it's a lot and there's so much more, right, we could talk about within this topic, but it gets us started and it gets our wheels turning of like, the reframe and looking at it differently. So super thankful. And people can find me on LinkedIn under Nicole Will. I share quite a bit there. The WillGatherPodcast.com is the website where all of the podcasts live. We've had over 200 guests, their interview style. So a lot of different really cool people to connect with there. And WillGather.com is the website where people can learn more about my work and connecting with how I support organizations and missions and people. So
Yeah, appreciate it. And thank you for the heart that you bring to all conversations. And again, this is why I made you late to your session at our gym, is because going back to the peeling the onion, a conversation starts a different conversation, would start a different
it's so
conversation.
good.
And
Yeah.
this has been no different. Thank you again. And looking forward to seeing you at a future event,
Yeah.
especially Think Tank. I'll tell you that.
Can't wait. Thank you.
All right. Thank you, Nicole. Thank you, Nicole, for reminding us that behind every senior living decision is a family navigating emotion, complexity, and often exhaustion. As marketers, operators, and caregivers, we have a responsibility to do more than promote. We need to truly connect. So before we go, here are 3 actionable takeaways from today's conversation. First, create a caregiver support role or initiative in your organization, someone focused on guiding and supporting families long before the move-in. Second, partner with caregiving influencers and community voices who are already building trust with families online. Their stories and platforms are powerful tools for education and connection. And third, rethink your marketing strategy to be resource first. Ask yourself, are we providing real value to caregivers or just pushing messaging? By shifting our focus from transactions to trust, we reshape how families experience this journey and how they see us as partners in it. Thanks again to Nicole Will, and until next time, let's go create some meaningful connections.